It is rightly said that skin is a mirror of internal organ. So what is going inside the body can reflect in your skin. There are certain skin conditions that tell us that something going wrong or there are some internal issues. In this video, we'll discuss about the condition which has deep correlation with our underlying metabolism. Have you ever noticed thick patch over the neck or your underarms, and when you scrub it, it's not going, and also sometimes it's associated with tiny bumps of skin growth. This is a condition known as acanthosis nigricans, and the skin growth is known as acrocadons or skin tags. So this acanthosis nigricans and skin tags are deeply associated with a condition known as metabolic syndrome. It has been found that around 70% of the patients having this condition have underlying insulin resistance. There's a condition where our body is not utilizing the insulin properly. That's why it leads to insulin resistance. It's a condition of pre-diabetic. That means you are in the range of abnormal blood sugar. May not be you have developed proper diabetes. In future it may progress to diabetes. So if you are having this condition, don't take this condition lightly. You have to consult a dermatologist, and also there are some certain tests like fasting blood sugar, postprandial blood sugar, lipid profile. These are tests need to be done to rule out any underlying metabolic cause, to rule out any borderline blood sugar or borderline diabetes. So why this happen? So when our body secretes more amount of insulin, that stimulates on our skin and leads to a growth factor known as epidermal growth factor. And that leads to overgrowth of the skin, leading to thick and pigmented skin, that is classically known as velvety skin, and also lead to skin growth. First and most important thing is you have to rule out any underlying diabetes or any metabolic syndrome, and accordingly we decide the treatment. The first and most important treatment is to rule out and to correct the underlying metabolic issues. It has been found that if you will control the underlying disease, or if you will take the care of the underlying disease, 60 to 70% of this pigmentation will go. Along with that, you have to take care of lifestyle modification like weight reduction, and also the diet, and also exercise. These are the key factors to reduce the weight and to take care of the obesity, and which will eventually improve this skin condition. In certain cases, even after doing this thing, the pigmentation may be stubborn, it may not improve completely. In that case, we have treatment options like Q-switch laser, chemical peels, and there are certain topical creams available that helps in improving the pigmentation, also the thickness. Along with that, for the skin tag, the only definitive treatment is by removing this tag by the laser. However, as we discussed, the definitive treatment is at the root level. So along with the treatment, if you will take care of the metabolic part, if you will take care of the weight, obesity, metabolic syndrome, then we can get rid of this condition permanently.